it is desperately important that we all wear masks. With that, I'm going to turn it over to Dr. Haushalter.
Thank you, David. And you're going to hear some repetition, but we think it's important today to hear from a variety of us on the same topic. I'm not going to cover any data. I just want to reinforce some key messages that's based on the data. But also I want to address what I would think your concern is, and that is whether or not we're going to shut businesses down or begin to limit businesses again. And so one of the key takeaways today is that if we all do our part to protect ourselves, each other, our families, and our communities, we can move forward without impacting businesses to the degree that we did earlier in the pandemic. So some of the key takeaways that you've heard both from Chief McGowan and David have to do with masking. I want to reinforce what I said Tuesday. There are many counties that do not require masking. It's important that wherever you travel that you wear your mask, regardless of whether it's required or not. Clearly you want to wear them in public places, but as we've been saying more and more lately, as you have guests at your house or perhaps you visit somebody else's home that you don't live with, it's really important to wear a mask and social distance. And I want to highlight what we haven't heard today is that we really want to protect our most vulnerable populations. So as our numbers continue to go up and we continue to have transmission, we're going to see more cases in those who are seniors, so people above 55, and those who have chronic illnesses. And we know that they're going to suffer the worst outcomes from the illness. So really wearing a mask when you're around others, and particularly those who have chronic illnesses. We've talked a lot about social distancing and hand washing, so I don't want to speak to that. I do want to talk about limiting social outings or gatherings. We do want people to frequent our local businesses, but if you choose to go to a restaurant, really try to go at a time of day where it's not as busy. Wear your mask at all times with the exception of when you're eating or drinking. And those are things that will reduce transmission to those at your table, but also to those who are employed. Also, as we come into the holiday season, we're all looking at how we can spend time with family and friends. So you really want to think through your holiday plans currently. You want to limit the number of people who are in your home, or if you're going to someone else's home, generally you want to limit it to your household and perhaps one other household. So that does change our traditional holiday season, but it's important this year that we begin to think about that and plan now, but also to stay home if you're ill. So if you have any signs or symptoms, you may at the last minute opt not to participate in a holiday event because you want to make sure that you're not spreading it to others. And then I want to reinforce what was said about not going out and about, going to work, going to church, going to other places when you have symptoms. What you're probably thinking is, how do I know that it's not a cold? How do I know it's not my allergies? I've said before, all of us have had the flu or a cold, and we say to ourselves, I'm not feeling like myself today. When you have that thought, that's really the day that you need to stay home. Any symptoms that are COVID-like symptoms, so that's cough, fever, some people have sneezing, obviously the loss of taste and smell. Those are reasons that one should stay home and surely get tested and then wait until that test result comes back before you do anything else. Next week, you're going to hear more about assurance testing, or what we call targeted surveillance testing. This is something that employers can offer to employees. It's regular testing of individuals who are asymptomatic so that cases can be picked up quickly, isolated, and quarantined.